Hello, healthy women. Today we are going to talk about infertility. Infertility is a condition where couples, the male and the female, live together for a year and have difficulty in getting pregnant. Infertility could be caused by several factors. Male factors is responsible to like 40% of the reason why couples cannot get pregnant. Female factor can also be 40%. 15% will be because of both couples. And then 5% unknown. When a couple is diagnosed to have infertility, they should seek help by going to the hospital. When they get to the hospital, we're going to ask them a lot of questions. Some of the question is, how frequently do they have sexual intercourse? A couple must have sexual intercourse at least 3 times a week, starting from after the menstruation of the woman. And this should continue for like 2 weeks in order for them to achieve pregnancy, because that will be, time of ovulation will be within that 2 weeks. The condition that also the man should fulfill, he should be able to achieve full erection and sexual intercourse. And during the sexual intercourse, he should be able to release sperm into the genital tract. Other tests that we ask for when a woman is being investigated for infertility is for her to do hormonal tests, where we look at the functionality of the eggs. We also ask her to do a stereosalpingogram, where we check for the patency of the tubes, the fallopian tubes. And this will ensure that the eggs, once they are produced during ovulation, can pass through that tube into the womb for conception to take place in the tubes before it will now implant in the womb. Other investigations that should be done is the semen test. When a male is asked to bring semen for test, it is preferable that he abstains from sexual intercourse for 3 days to 5 days. And then he should produce the sperm by masturbation. It is better than to have sexual intercourse and quickly try to put the sperm into a bottle. This will make, and immediately after he takes the sperm, it should go to the lab. So the test should be run within 30 minutes of sperm collection. Once the results are out, it will now be interpreted to find out who is responsible for the infertility. And of course, there are treatment options. If it is a female infertility, either due to too much of hormones in the blood, like the prolactin hormone, when she has breast discharge, then there are drugs to use to stop that. If it's because of blocked tubes, there are other options like in vitro fertilization or intrauterine insemination, or different types IVF that can be done for her. If it's a male factor infertility, the man can have treatment from some herbal stroke, scientifically proven drugs that he can take to help to restore fertility. Sometimes the male may need to see a urologist if he has problems with varicose vein and testicular insufficiency from either mumps infection when he was in childhood. Couples should also be hopeful that there will be a solution to their problems, and then they can get pregnant and pray. Prayer is very important as well, please. So we always want the couple to have a positive mind frame and to be hopeful and happy that solutions will be given to them. For those who have fibroids, this can be removed if they are too much in the uterus. That will also aid them in getting pregnant. So keep staying healthy and keep being happy.